So now that we know how to calculate breast cancer risk, we move on to our next question, which is who should be referred for genetic testing? Now, these guidelines change on a pretty frequent basis, but as of early 2023, most genetic counselors will follow the NCCN guidelines for testing criteria. Firstly, they recommend genetic testing in any patient with a relative that has a pathogenic or likely pathogenic mutation in a cancer susceptibility gene. Testing is also recommended in any patient with a personal history of breast cancer diagnosed before age 50. In patients with a personal history of breast cancer diagnosed at any age, testing is recommended if the cancer is triple negative, if there are multiple primary tumors, if the patient is male, if there's Ashkenazi Jewish ancestry, or if the patient has a family history with one or more close relatives with breast cancer before age 50, ovarian cancer, pancreatic cancer, high risk or metastatic prostate cancer, or two or more close relatives with either breast or prostate cancer. In patients without a personal history of breast cancer, they can be eligible for genetic testing if they have a first or second degree relative who meets any of the criteria listed previously, or if they have a greater than 5% chance of carrying a pathogenic BRCA1 or 2 mutation based on risk assessment models. Another thing to keep in mind is that genetic testing is way more comprehensive than it was even 10 years ago. While BRCA1 and BRCA2 mutations remain the most common, there have been multiple other genes associated with familial breast cancer, including ATM, BARD1, TP53, PTEN, CDH1, CHEK2, NBS1, NF1, RAD51C and RAD51D, STK11, BRIP, PALB2, and many others. So if you or a family member were tested in the past and were negative, but you have a family history that's strongly suggestive of a genetic cause, it might be time to look at the gene panel that was run and to consider retesting.